Hi, I'm Nikki Demarks, 104.1 Wdlt, and girls, ladies, guys, this is very important what I'm getting ready to do. And I know my phrase is don't make me party with you, but right now, October is Breast Cancer Awareness Month. And we're talking right now to Dr. Hunter of USA's Health Department. Hello, good morning.
Good morning. Thank you for having me.
Well, it's a joy, but I was expecting a grandmother in the 60s, but now we have someone young, and that helps because you are the new age, and maybe that's what we need in the medical industry and also in other industries. Now, Dr. Hunter, why is breast cancer awareness so important?
So breast cancer awareness is still so important today because even though we've seen a decline in mortality rates, what with better screening and imaging and focusing on prevention, we're still seeing the same number of incidents. So 1 in every 8 women will develop breast cancer during her lifetime. That's a 12% chance of developing breast cancer, which is, that's huge. It's not insignificant. And so, breast cancer is still very prevalent, a huge issue, a huge topic. It's next to lung cancer. It's one of the most common cancers that, women get and die from.
Mm-hmm. Well, look, I want to ask this question. Now, early detection, there are routines, but some women, I know some women that actually have a fear of going to doctors for the breast examination. I was always taught as a young man, I'm 64, I was always taught to do home exercises to check for lumps. Is that still good? Is that still, is that?
Right. Yes. So there's a lot of controversy on that topic. It kind of depends on who you ask. And the reason for that is because, a lot of women just naturally kind of have what I like to call busy breasts, meaning, you've got cysts, you've got fluctuations in the density of breast tissue, especially during the menstrual cycle time. And so oftentimes women will feel something and it'll end up being benign, but it will end up causing a workup, biopsies, unnecessary imaging, all for nothing. That being said, though, every once in a while, I still have women who come in who found a lump that ends up being breast cancer. So I think the bottom line is know your breast, get a baseline for what your breasts feel like so that if there's something new and it is persistent, after you've had your menstrual cycle and everything, if it's persistent or continues, if it changes, then you need to bring it to somebody's attention. So I think the self-exam is can still be a good tool.
So you agree with the home remedies first to check?
Yes.
Okay, now I'm 64, and I told you earlier, and I was amazed to see how young you are as a doctor. So does the age have anything? I don't have any history in my family from both of my father's side and my mother's side of breast cancer. So how does that affect me? I'm speaking for me.
Right.
So everybody's listening, you're watching, but I'm talking about me now.
Yes. Well, so, the average age of women, the life expectancy is 85 years old. So, we all got a long life to live. Mm-hmm. And so anytime, during your lifetime, kind of like I said earlier, you've got a 12% chance of developing breast cancer. That's without any risk factors. You start adding in a family history or even if you've had benign breast disease, all that does is just kind of add on to your risk of developing breast cancer. And we know that as we age, the risk of it goes up. Most breast cancer tends to occur, the median age for it is in the 60s for women. So I think it's still very important for even the older generation and our mature audiences to still make sure they're getting their mammograms.
Okay, so guys, I'm not, but I do have a fear, and I've talked to some of my friends who say, oh gosh, Nikki, when you go in and get a breast exam, oh gosh, it's they mentioned the pain. How can we make breast cancer exams less painful? I mean,
well, yeah. So the breast exam itself should not be painful. You know, just your physician is just palpating different areas on your breast. It really should not be that painful to the point of complete discomfort. Again, you know, women's breasts go through periods of being more sore, that kind of thing, but it should not be excruciating by any means. So if it is, I would, you know, kind of question what they're doing, maybe have them stop or tell them to decrease the pressure. As far as a mammogram goes, that's a different story. And unfortunately, you know, that process, it may seem archaic, but it's still the best tool that we have. And sometimes it is unfortunately painful because you do have to get that compression and you have to get all of the breast tissue into the view to be able to have an adequate imaging study.
Okay, let's talk about this BRCA, the mutation. I mentioned, yes. I want to, because I've been reading about this more and more, and it looks like it's very expensive, but it can be stopped. So we've got a way to get out of having breast cancer with this BRCA mutation. So is this something that only celebrities? So far, only celebrities are doing it.
Well, so I think it's gotten a lot of attention in the media. That is very true, especially with celebrities. I think, you know, Angelina Jolie is one who had a BRCA. But BRCA, basically what it is, just to kind of give you an overview of what this gene is. It's a tumor suppressor gene. You know, everybody is born with one. And its job, it's a protein that helps repair damaged DNA. So if you have a mutation in that gene or it's altered in any way, then it's going to, you know, that process is going to be affected and it's not going to be able to repair DNA appropriately, which then sets you up for the development of breast cancer. So basically, you know, what we know from this gene is if you have a mutation in it, your chances of developing breast cancer are very high. There's two BRCA genes. One is BRCA1, one is BRCA2. And if you have BRCA1, your chance of getting breast cancer by the age of 80 is 72%. If you have type 2 mutation, it's 69%. So both of them are very high. And that leads us to, you know, having conversations with patients about earlier screening. These patients should be getting mammograms at an earlier age, mammograms or MRIs, as well as breast exams at the age of 25. And they should also be having discussions with their providers about undergoing what we call a risk reduction mastectomy, which basically is undergoing, you know, removal of both breasts because their chances of developing breast cancer are so high. It's just kind of a matter of time and when, of which nobody can tell you. But that's why so many women opt to undergo that breast cancer or that surgery sooner in life. We're talking in their 30s sometimes.
Okay, this is great. I wanted to know that. This is, you know, I'm talking about me. I'm worried about me right now.
Yes.
So, you know.
But I will tell you, if you don't have anybody in your family that has had breast cancer or ovarian cancer, these genes are also linked to ovarian cancer, and or you don't have any male members in your family that have had breast cancer. Yes, men can get breast cancer. Then the likelihood of you having this gene is very low. And so we don't just go around testing everybody for it. There's a few criteria we looked at. Some of them I just listed that if you meet some of those, your insurance will cover testing for this gene.
This is great. I mean, I hate to say this, but ladies, men who are listening, I'm worried about me. So, and hopefully the question I'm asking, everybody wanted to ask, but they were afraid to, because a person like Dr. Hunter, I would highly recommend you. To women who are actually scared and want to ask these questions, because you have answered every question that I want to know. You know, but my thank you.
Well, and you know what? At the end of the day, you got to look out for yourself because no one else is going to. So the fact that you're worried about yourself, putting yourself first.
Yeah, bingo. And this is great. This is great. Dr. Hunter, thank you for being the future of being so young. I was, like I said, I mentioned, I want to let this know. I was expecting someone in the 60s and the 70s. But for you being so young, you give you the new age of saying, hey, we've got better treatments. It's not like it was your old granddaddy's Buick. So that helps. But I thank you. I thank you for answering my question.
Thank you so much. Thank you so much for having me. It's my pleasure.